Hi guys, I thought I'd come to you today with a quick video just to talk about traction alopecia and give you 5 quick tips to help prevent or reverse signs of traction alopecia. Now, just as a quick background, remember I've talked about the 3 stages of traction alopecia. Stage 1 is when it's largely reversible. So this is when you have a normal hairline, you wear some sort of braided extensions or weaves or wigs, and you take it out and you notice your hairline is thinner. That stage of traction alopecia is the easiest stage to treat. And so we are going to be talking about tips for stage 1 traction alopecia. Stage 2 traction alopecia is when you have noticed a thinning hairline that's gotten worse over time. Maybe you've stopped some of these practices that you've used in the past, but your hairline still is not bouncing back. At that point, it's responsive to medical therapy. In stage 3 traction alopecia is when you're in a similar situation, you notice that your hairline has gotten progressively thinner over time, but at this stage, it is not responsive to medical therapy and is only responsive to a hair transplant. So let's dive straight into the tips. So tip 1, if you have traction alopecia, get a diagnosis. Right, so we talked about stage 1, stage 2, stage 3. Well, how do you know if, for example, you're stage 2 or stage 3? You're going to need a dermatologist to help you out. Now, they may not actually use those exact terms because those are just terms that I use when I talk to my patients about traction alopecia, but they can tell you if they believe that your traction alopecia is reversible or it will respond to medical treatment. Tip number 2 is for you to try scalp massaging. Now, this is going to be most effective for women with stage 1 disease. You can use your favorite oils. A lot of people like to use castor oil. You can go to town with that. You can use olive oil, anything that's going to help you moisturize that hair. But remember, it's going to be better if you do a scalp massage on hair that is slightly damp, maybe with some leave-in conditioner, especially if you're doing rubbing. But you only need to do kind of a localized massage where you're not moving your fingers too much just to get the blood flow going. And 5 minutes of scalp massage a night can stimulate hair growth. But remember, this is really for stage 1 disease and is less likely to be effective for more advanced diseases. Tip number 3. So for tip number 3, you want to start thinking about hairstyles that are less likely to pull at the hair. So let's say you have a thinning hairline and your go-to style is box braids and you're like, okay, box braids really aren't working for me. Well, maybe take a step down with a hairstyle that's less likely to pull, like crochet braids, or maybe a wig that you remove on a regular basis. So this is a tip that can be very effective for women with stage 2 disease, especially as they are going through possible treatment. Whatever you decide, make sure it's a style that you do not keep in your hair for too long, because that will make things worse. And that kind of gets us to our next tip, tip number 4. You really want to make sure that you are taking care of your hair and moisturizing it as often as possible while it's in any braided or protective style, because dry hair is more easily pulled out. One of the things about traction alopecia, a lot of people will say that their braided styles or their hairstyles don't feel tight, but it doesn't need to feel tight to pull out your hair. Feeling tight is a sign of impending traction alopecia only when you're young, because when we're younger, our hair is more resilient and it really only gets pulled out if it feels really tight. When we get older and our hair loses some of that resiliency, you can actually get hair loss even if it doesn't feel tight. Okay, so make sure that your hair is moisturized so it's more likely to stand up to damage. Make sure you're getting your protein treating regularly if your hair needs that, and then your deep conditioning with every wash. And then tip number 5, this is the most important tip, is to really get comfortable wearing your own hair. I can't tell you how many women I see who come in with advanced stage 2 disease and they're really teetering on the edge of a hair transplant, but they don't feel comfortable wearing their own hair. It's really almost impossible to make progress in treating traction alopecia if you don't feel comfortable wearing your hair out. Remember, these styles like wigs, weaves, braids, they're only meant to give your hair a little bit of a break, but in the long run, they can lead to worsening breakage and damage, especially to that hairline. So all of those hairstyles should really be used in moderation. You can scour YouTube. There's so many resources to give you ideas of styling tips that may be helpful for you, but whatever helps you wear your hair out, whether that means cutting it or having a stylist shaping it or even texturizing it. If anything that will get you to that end goal of feeling more comfortable wearing your hair, it's going to be healthier for your hair in the long run. But do be prepared to do the work required to keep your hair healthy. Natural hair, curly hair requires a lot of TLC. I have a lot of these tips and tricks in some of the books that I've written, but also in my free ebook and on my website. And there's several other dermatologists who've provided similar resources as well. So I hope that these tips can be helpful. I'll actually give you a bonus tip. The bonus tip is minoxidil use. If you are in stage 2 disease and you're not noticing any improvement with your hairline, and it's been a few months and you thought it would bounce back, but it hasn't, you really should try over-the-counter minoxidil. And this is a great first step even before you see the dermatologist. So feel free to check out my website, crystalalgoodmd.com, or check out my Instagram page if you have more questions. Bye.